If you're on a Medicare Advantage plan, there's news this year you need to know about. Insurance companies are dropping Medicare Advantage plans at a pace we haven't seen before. Nearly 3 million people have already been affected. Hi, I'm John. I've spent years helping people navigate Medicare, and this channel is where I break it all down in plain English. No jargon, no sales pitch, just what you actually need to know. Here's exactly what's happening, and more importantly, exactly what to do if it happens to you. Insurers are dropping Medicare Advantage plans. What to do? Here's the situation in plain and simple. A study published in February 2026 by researchers at Johns Hopkins Bloomberg School of Public Health and Georgetown University, released in the medical journal JAMA, found that about 2.9 million Medicare Advantage members were forced to disenroll in 2026. That means their insurance company either pulled out of their area entirely or ended that specific plan. That's roughly 10% of people in individual Medicare Advantage plans. To put that in perspective, from 2018 to 2024, that number was about 1% a year. Insurance companies like Aetna and Humana have both pulled back significantly. Reporting from Forbes and other outlets found Aetna alone dropped around 90 plans across 34 states. Companies say lower government reimbursement rates are making some of these plans too expensive to keep offering. Now here's the part that matters most, and it's genuinely good news. If your plan gets discontinued, you are not left without options, and you don't have to wait for the fall annual enrollment period. You automatically qualify for something called a Special Enrollment Period, an SF, that lets you pick a new Medicare Advantage plan or move to Original Medicare outside the normal enrollment window. If you get a letter saying your plan is ending, that letter itself is your green light to act. You don't need to panic, and you don't need to wait until October. Here's the part I want you to really pay attention to. If you switch to Original Medicare after losing your Advantage plan, there's a gap you need to know about. Medicare Advantage plans have a yearly cap on what you pay out of pocket for medical services. Original Medicare has no such cap. So if something serious happens, a hospital stay, a major procedure, your costs could keep climbing with nothing to stop them. That's exactly what a Medigap supplement plan policy is designed to prevent. If you're moving to Original Medicare because your Advantage plan ended and looking into a Medigap policy, you'll also have to get a prescription drug plan. Original Medicare does not cover medications. So here's your action plan, plain and simple. 1. If you get a letter saying your plan is ending, don't set it aside. That's your SEP starting. 2. You don't have to rush into a decision, but don't wait until the last minute either. Compare your options using the same total cost approach I always talk about, not just the premium. 3. If you're leaning toward Original Medicare, look into Medigap and a drug plan at the same time, not after. That timing matters because underwriting can get stricter the longer you wait. Bottom line, insurers pulling out of Medicare Advantage is a real growing trend, but you have real protections if it happens to you. Don't panic, don't ignore the letter, and know that you have options and time to use them wisely. Subscribe to stay ahead of Medicare changes for 2027. I'll keep bringing you what's happening in plain English as soon as it matters. Subscribe to stay ahead of Medicare changes for 2027.